So today I'll be talking about breast cancer. So the definition of breast cancer, this is all from our book, is it's not just one disease, but rather a group of diseases that result from unregulated cell growth. So without regulation, cells divide and grow uncontrollably until they form a tumor. All cancer is a result of changes in DNA or chromosome structure that cause a mutation of specific genes, and breast cancer starts in the epithelial cells that line the mammary duct within the breast. So who's at risk and some risk factors? An estimated of 80% of women whose breast cancer developed have no documented risk factors. And then risk factors include previous abnormal breast biopsies, exposure to chest radiation, early menences, so less than 12 years old, or late onset menopause, greater than 55 years old, not having children, or late childbearing after the age of 30, postmenopausal use of estrogen and progesterone therapies, failing to breastfeed for up to a year after birth, alcohol consumption, cigarette smoking, obesity and consumption of a high-fat diet, sedentary lifestyle, and lack of physical exercise. So some complications of breast cancer is metastasis to primarily to the bones, lungs, lymph nodes, liver, and brain, swelling of the breast, and infection, and death. So breast cancer can metastasize to anywhere in the body, but for the majority of the time, it's to the bones, lungs, lymph, liver, brain. So some clinical manifestations include a breast lump or thickening of the breast, change in size, shape, or appearance of the breast, dimpling of the skin, blood or discharge from the nipples, and pain. So therapeutic management, so breast conservation surgery. So this is the least invasive procedure, and it's a lumpectomy, and it's a 1 centimeter margin of normal tissue. It's basically removing the suspicious mass along with the tissue of the malignant cells to prevent reoccurrence. Then we have a mastectomy, and there are radical mastectomies, simple mastectomies. They're removal of all the breast tissue, the nipple and the areola, the axillary nodes, and the pectoral muscles. Sometimes that can be spared. And then breast augmentation usually happens after the mastectomy, and it's a surgical procedure that women undergo with the implants, and it's usually reconstructive surgery, and you can get saline-filled or silicone-filled implants. And then radiation. They use high energy rays to destroy the cancer cells that may have been left behind in the breast, chest wall, or underarm area after a tumor has been surgically removed. And then we have chemotherapy, and it's the use of drugs that are toxic to all cells and interfere with a cell's ability to reproduce. They usually work against malignant cells, but affect all rapidly dividing cells, especially in the skin, the hair follicles, the mouth, the GI tract, and the bone marrow. And then lastly, immunotherapy. It's used in adjunct to surgery. It's supposed to stimulate the body's natural defenses to recognize and attack cancer cells. So there are many pharmacologic treatments drug-wise. So I just put 2 that I know of, so methotrexate and tamoxifen citrate, and then obviously I added chemotherapy as well. So some nursing diagnoses are disturbed body image related to loss of body part, primarily the breasts, disturbed body image related to loss of femininity, and disturbed body image related to loss of hair due to chemotherapy.